Well, welcome back to Talking Team CBT. Today I'm super excited because we have Dr. Jacob Towery. Welcome, Jacob.
Thank you. Thanks for having me, Angela.
I'm super excited to talk to you about Team CBT and how it's affected you. Can you tell us a little bit about how you got involved in team?
Sure. So in 2006, I started my residency in adult psychiatry at Stanford, and I became friends with Maor Katz, who was in my residency class. And he had been doing the Tuesday night group with David, I think for about a year at that point. And there were a whopping like 5 people in the group on average per week. And he was like, Jacob, there's this group I think you'd really love. And I was like, okay, sure, I'll check it out. So I checked it out and he was right. I loved it. And so started attending probably around 2007. And then Angela Crum had joined around the same time as I did. And then I think a couple months later, Jill joined. And it was still small though. It was probably like 7, 10 people on average. And then it just kept growing, growing, growing. And then I asked David if he'd be willing to be my individual supervisor for a year. I think it was around 2008. And he generously said yes. So Mickey Trockle and I got to go over to his house every week for like, I think like 2 hours or something. And I got to learn directly from David and be a learner in the group. And then eventually he let me be one of the small group leaders and I got to teach in the group. And it's just been a wonderful community and model and big part of my life.
Well, that's really cool that we're hearing that pattern of story where they happen to be at Stanford and kind of run into people and learn about David's group and how the Tuesday group has expanded. So you're right there at the beginning, just a few people. And I can imagine coming from like Stanford where the classes are quite large, impressive type classes, it kind of felt a little maybe off-putting or maybe it felt intimate. What was it like to be in a small class with David?
It did feel intimate. So I was pretty lucky. The Stanford psychiatry residency was a little smaller than it is now. In my class, I think we had maybe like 11 or 12 people. So most of our classes were 11 or 12 people compared to like the undergraduates where it could be, hundreds of people.
Right,
So
right.
most of the classes were pretty small already, but we had some Tuesday night groups where it was like 4 people or 5 people or something. So it was pretty small and intimate, but I really liked it. I just from the get-go, I liked David's approach to therapy and I loved his emphasis on practicing and getting feedback rather than just talking abstractly about things.
Mm-hmm.
And he was really into preparing us for a lot of different potential therapeutic situations. So I felt a lot more ready if I were to have like a patient who was suicidal or if there was erotic transference or someone was angry with me or someone wasn't doing their therapy homework, very practical situations. So, and it was fun. It was interactive. There was a lot of role playing. It was playful. It was fun. So yeah, it appealed to me from the get-go.
Cool. Um, well, how has team impacted your clients?
I think Tim has impacted my clients pretty significantly. Right now, it's the only model that I do. So I bring in other things into team, but it's the only overall full model that I do. So I think it's impacted my clients pretty significantly. It's not uncommon that I see someone with depression or anxiety or a phobia or something else, and within a few weeks, they're significantly happier, they're more calm, their life is going better. Um, so that's pretty rewarding to see that pattern happening somewhat consistently. I don't think I'm patient enough for a model therapy that would take years to
I don't think I either.
have major effects. So
Yeah.
I don't think a lot of my clients want that either. So it's satisfying seeing it get results pretty quickly.
Yeah. Um, I knew like, when I asked you to do that form impacting clients, you mentioned a client um, who had some anxiety and suicide. Would you tell us a little bit about that one?
And I'll change some details around just for confidentiality.
Sure.
But one client who would fit that was a wonderful guy who had had some recent big life changes in terms of relationships and um, extremely, extremely anxious, just kind of overwhelmed with anxiety, hard to function, really interfering with his sleep
Mm,
and causing panic attacks and just disabling anxiety
mm, mhm,
to the point where he wasn't sure if he wanted to keep living. And
mm,
but just a really sweet guy, sweet, wonderful guy, very motivated to do whatever I told him to do. So I taught him how to meditate and had him develop a daily morning meditation practice really early on. He said that ended up being probably the most helpful thing we did. Um, I've developed a technique specifically for panic attacks. So I taught him that, and then he didn't have any more panic attacks. So at least that was off the table and things were less overwhelming. We did a lot of cognitive work to work on his thoughts and his feelings. Um, and he started re-engaging. I think that was something he'd been doing a lot less of his hobbies and things that he was passionate about, and got back to kind of re-engaging with life and doing things he was excited about. And yeah, I think within maybe 3 or 4 weeks, he was feeling a lot better. And maybe a month later, we didn't really need more treatment. And he was really grateful and happy. And that was very satisfying to see him doing a lot better.
yeah, and that's fantastic that it was 3 or 4 weeks. I think that, people suffer so long and so intensely that to have relief like that is pretty mind-blowing for people, and definitely encouraging. And I think it helps with the motivation when they can start to see the changes and they can re-engage. I know you mentioned mindfulness and meditation, and you talk about that in your book. Tell us a little bit about your book.
Sure. So I wrote this book called The Antidepressant Book, A Practical Guide for Teens and Young Adults to Overcome Depression and Stay Healthy. And originally I wrote it with teenagers in mind and maybe people in their early 20s, but I've now assigned it to people older than that, people in their late 20s and their 30s and their 40s, and they've told me that it's been helpful. So I'm now kind of expanding my age range of where I think it can
Sure.
be useful. Um, my goal was to um, introduce some of these team CBT concepts to a lot of teenagers struggling with depression in terms of the
Mm,
relationship between thoughts and feelings,
right.
and getting out of these pejorative labels, addressing things like outcome resistance and process resistance, and talking about all the good reasons people have for holding on to depression, while also integrating a lot of healthy habits and routines that I think are particularly important for people who want to get out of depression: meditating, exercising, getting
Mhm.
adequate sleep, etc. So the book is ideally a tome that people could read to stop being depressed and then also thrive in life after that.
I love that because I mean that's how I got into this. Was I had major depression and I did a program called the Depression the Way Out, which was an integrative approach. So we did exercise, meditation. We
Mm-hmm.
used, I mean, we came from a Christian perspective, so it was active meditation, but there was,
Yeah,
a lot of pieces, a lot of components that just built on each other. And one of them was Dr. Burns' book. That was part of the homework, was we had to read Feeling Good. And it was mind blowing, like this whole rational brain and all that kind of thing. So I think that's great that you're incorporating that, and I'm trying to do that more with my clients and creating some healthy habits, because we're a package deal.
wonderful.
Yeah. And
We
then
are we are a package deal. Yeah.
another thing that I've seen you do and seen some YouTube is shame attacking videos. So tell us a little bit about that. What's that about?
Yeah, so I learned that 100% from David. I don't think it would have ever even occurred to me to do things like shame attacking if I hadn't, gotten involved with team. Um, so shame attacking exercises are, I think, a really fun thing that people can do if they worry more than they would prefer what other people are thinking of them, if they think other people are looking down on them or judging them, or they care about having people's approval, which a lot of people with social anxiety struggle with, as you know, but also even people without social anxiety can, I think,
Sure.
be overly preoccupied with thinking, what do strangers think of me?
Hmm.
So shame attacking exercises are a wonderful way of getting out of that. So as you know, people can go out and deliberately, and I think maybe Albert Ellis was one of the first people to
Hmm.
describe these, and,
Yeah.
and he had some really creative, fun ones. But people go out and they deliberately do things that are embarrassing, silly, ridiculous, And you really kind of invite other people to laugh at you, judge you, look down at you. And I love doing this with my clients because very predictably, they're slightly terrified to leave the office and go out and do this,
Yeah.
more terrified as it approaches, and they think it's going to be much more horrible than it turns out to be. And at first, they're like looking around and what do people think of them and are they judging them? And soon they realize people are judging them and we're doing absurd things. And yes, people are laughing at us and judging us, and the sky doesn't fall. They don't lose any arms or legs. The world stays about the same. Most people actually don't even really care. That's always a very surprising thing people have, that people
Mm.
just go back to being on their phone or talking to people. They don't even really care. So I think that they're very liberating for becoming less preoccupied with thinking what other people think of us and caring less about it.
No, that's great. I like them too. I think though it gets to the point, and I don't know about you, but eventually it's hard to do shame attacking after a while because you don't really feel the shame anymore or the anxiety. So it just becomes fun, which is, you know, great. It's a great outcome. Um,
It does become fun. I was in San Francisco International Airport, SFO, maybe like 3 or 4 weeks ago. Um, and I had a red eye flight coming up, and I realized that my mouth was kind of disgusting because I hadn't brushed my teeth since the morning and I was going to be on this flight for many hours. So I went and bought this little travel kit that had like a little toothpaste and toothbrush, and I brushed my teeth. And then I was like, well, I have a bunch of toothbrushes. I don't want to just carry this toothbrush around, for the next week. I have a ton. So I tossed it out. Then I had this toothpaste, which was almost full. I just used it once. And I was like, it'd just be a shame to throw this away and just kind of fill up the landfills. It's perfectly fine toothpaste, and we've only got one Earth. So I started going around to people at my gate asking if anyone wanted a used toothpaste. And I probably talked to about 30 different people. And it was really fun seeing the range of responses that people had. But it was a little anxiety provoking. I remember one person was kind of like shielding his children. He looked like he was like, maybe I was
what's
kind of
this crazy
crazy
guy
and like,
doing?
who is this person? Is he dangerous? I felt a little sting. But for the most part, I
Mm.
thought it was just fun. And yeah, it's hard for it to raise a lot of anxiety for me these days. But still think it's
Yeah.
fun to challenge myself to do weird stuff.
You touched on something really important, that you felt a little sting, and so it kind of is a bit of a relapse preparation, right? Like you're preventing relapse by having that little sting and kind of keeping it at bay, which is really cool. Kind of reminds me of,
Yeah.
for those watching on YouTube, if you're interested, look up a channel called Seeking Discomfort. Because they do kind of, it's not, the intention isn't shame attacking, but it's kind of what we would call shame attacking at a lower level, but just create some great relationships. It's quite interesting. um well, we're going to run out of time, but I want to hear a little bit about, tell us a little bit how team has affected you personally.
Yeah, team has affected me personally, and I think many different ways. It's helped me be less perfectionistic. I think I used to be more perfectionistic than I am now. Like, for example, I don't know if it's audible or not, but we're running the washing machine and the dryer in my condo because we just got back from a week-long trip and we have many loads of laundry. And I thought about like pausing the washing machine or pausing the dryer. And I was like, no, it's okay. Like if people hear there's a washer dryer, like, and they think less of me or think I'm unprofessional, like I don't really care. Like there's a lot of laundry to get through. I'm just gonna keep going and they'll survive. It doesn't really matter. Um, or I used to, I guess I still do this to some degree, but I used to correct all my text messages if there was like a typo or something, and then I do that less. And I'm like, okay, people will survive if there's a typo. And so there's some things I'm somewhat precious about, like with my patients, I try really hard to do a good job doing therapy. And if I'm sending out an email to all of my clients, I do double check those and try to make them look very professional. But in a lot of areas, I've lowered my standards. I try to be a pretty good dad, a pretty good boyfriend, pretty good at a variety of things. And that's good enough for me.
Yeah, that pretty good. And what you're saying is so valid, because we can be professional without being a perfectionist. And I think sometimes that gets lost in translation. That there's a way to be professional without it consuming. I did video editing and video production, and I mean, I could spend hours
Yes.
retaking, and and some become a waste of time because, like you say, a lot of people don't even notice, and the
Yeah.
people who do, they're going to find something anyways. So because
Right.
we're not perfect as
Yeah.
much as we want to be a perfectionist. um,
Yeah.
yeah, and it sounds like it's very freeing to have that experience.
It's very freeing. I think another thing that I really learned from David is just this concept of embracing ourselves as these flawed people. And that's actually one of my favorite things to help clients work on. I can't even, I'm sure you've had this experience. I can't even tell you how many clients come in and they feel guilty or ashamed about some aspect of themselves, some
Mm-hmm.
aspect of their sexuality or their desires or their wishes. And it's, I mean, it's kind of silly, like on a big picture scale. Like we all just have
Mm-hmm.
these primate brains, right? We're primates, we're animals, and yet somehow we think we're supposed to like not ever want to be aggressive or violent or mean, or we're
Mm-hmm.
never supposed to feel lazy or be petty or like that's really unrealistic. I think we're going to have all sorts of drives and desires and urges, and we're going to fail, and we're going to just be, flawed, imperfect selves. And on the one hand, I don't think that gives us license to be
Sure.
callous or thoughtless. I think we should still do the best we can to be reasonably thoughtful people moving through the world. But um, I don't think we need to walk around with a lot of guilt and shame for just being flawed. And we can learn from I make so many mistakes, but I try to learn from them and not make the same mistake over and over. But it's very freeing to just be like, yep, I can be lazy. I can be petty. I can be
Mm-hmm.
thoughtless. Okay, well, that's okay. I'll still do my best, but I'm not going to sit around and feel really bad about it.
That, and there's power in accepting it because it's pretty hard to change something we're not willing to even look at. And when we can look at it,
Right.
just like we can look at it and go, hey, this is kind of part of who I am. And I'm one of those lazy people, which a lot of people, they're like, really? Because I tend to be quite task oriented, so I get a lot done when I feel like it. But then I have to learn, sometimes I don't feel like it, and that's okay. I don't have to feel guilty because I didn't have those feelings. I can't manufacture or
Totally.
invent it, right? um yeah.
Yes.
um where's like maybe one area you'd like to hone your skills in team?
That's a great question. I was just thinking about this about 2 weeks ago. I was at this really cool conference called The Evolution of Psychotherapy, which was in Orlando for the first time. It's usually in Anaheim, and a lot of my heroes in the therapy world have spoken there. David and Aaron Beck and Marsha Linehan and Sal Minuchin, all these bigwigs. Um, and there's this guy, Scott Miller, who was there talking about deliberate practice and feedback informed treatment. And he got me kind of fired up about honing my skills more with the way I'm doing feedback with clients and maybe spending a little more time than I might otherwise going over the feedback with my clients and integrating that into the treatment and just making it really clear to them that their feedback is very important to me and that I take it seriously and that
Mm-hmm.
our relationship is very important to me and to I think the therapy and that uh, I take their concerns very seriously. So that's something I think I've gotten a little complacent on, and now I'm kind of excited to like bring that back into the work and focus on it more.
I mean, that ties together what you said earlier about being flawed. So if we're willing to see the flaws and we're not so obsessed about the perfectionism, we can take a step back and actually go, oh, where could I improve? And it not feel like it's this major weight or this major character defect because now I have to improve.
Yes,
Yeah, love it.
yes, I love what you're saying, Angela, and I think that we're also then modeling for our clients like it's not
Mm-hmm.
only okay to fail, it's inevitable that we're going to fail, it's inevitable we're going to make mistakes, but we don't have to spend a lot of time trying to avoid that. Instead, we can just learn from our mistakes and move on, and we can value the relationship, we can try and heal ruptures, we can be collaborative, we can work together. And I think that's just a much more practical, realistic way that humans can operate rather than trying to somehow be perfect all the time, which I'll never come close to, and I'm content with that.
Yeah, that's not. Well, we're out of time, and so we kind of our little signature question is if all the therapists or psychiatrists in the world were listening right now, what's one thing about team you'd want them to know?
That's a very good question. If you were a therapist listening to this, I would like to give you permission to be a little more behavioral than you might think that you are allowed to be or that you can be. So it's okay if you have certain behaviors or routines that you think could significantly improve the lives of your patients, whether that's meditation, getting adequate sleep, exercising, spending time in real life with other humans, um, getting spending less time on screens, whatever it is. If there are things that there's some evidence base to show that it's helpful and that you are passionate about it and you think it would help a lot of your clients with their goals, it's okay to incorporate that into your practice and to emphasize that. So cognitive methods are wonderful. I love cognitive methods. I think they're fantastic. And I think they can also be used in conjunction with a lot of behavioral methods and routine changing that's also really important to helping people feel better.
Well, that's a great wrap up because having that B in the CBT, right, is I think it gets neglected. And in team, we want to make sure we're trying to be as well-rounded as possible. Thanks so much for being here, Jacob. It was a pleasure having you.